My name is Jocelyn Herrington. I'm a graduate student from George Mason University in Virginia.
Jocelyn, what are you studying in Oxford?
I'm taking two tutorials. One is comparative health law, comparing US and UK health law, and the other is comparative health systems, looking at the structure and services provided by the NHS compared to the United States healthcare system.
How does your study in UK relate to your studies in America?
There is an ongoing debate in America about whether we should move towards a more universal healthcare system, something perhaps more like one of the European systems. And I was curious about that. So I'm here to learn a little bit more about the NHS and how it's structured and the legal underpinnings for the system, just so that I can decide for myself what I think about that question. And I thought it is interesting to learn among people who have national healthcare systems, since we don't have that at home.
Earlier on you mentioned the tutorials.
Yes.
Can you tell us any big difference between your university and the Oxford University education system?
Oxford is very unique. The tutorial system is something that very few schools do. I think maybe one or two universities in the States have it, but it's really unique to Oxford, and it's hard to explain to people from home what the tutorial system is all about. It's much more student-directed. I've met with my tutors and explained to them the things that I'm interested in, and we've built the course around things that are interesting to me. And it's a lot of reading. And it's very challenging because you get to go very in depth on a topic that is of particular interest to you, and then talk about what you've learned with someone who knows it better and can question what you've understood and make sure that you are getting what you should be getting out of the reading. It's very intense. There's nowhere to hide. And the essay process is also very intense, and it makes you a better writer, makes you more concise, and really helps to focus your understanding of a topic.
You know, in British education system, essay writing is very, very important, right from early stages at school. Is it the same in America?
There is a lot of emphasis on writing skills in America, particularly at the college and graduate level. But I think the level of scrutiny for the written product here is much higher than it is at home. And I think that comes back to the fact that you're working one-on-one with an instructor or with a tutor rather than in a class of 20 or 30 people.
I hope you will gain lots of confidence after all this tutorial and all this different training. Yeah.
Yes, I think so.
How does the UK health system compare with that of the USA?
It's structurally, it's very different. In the US, we have a model that's based on private insurance. People buy health insurance from private healthcare companies, and then go out and get healthcare from private doctors or hospitals. In the UK, you have the NHS, where the government employs doctors, owns the hospitals, and provides healthcare to the population at its own expense. That's a structural difference. So people who are citizens here in the UK don't have to worry about how they're going to pay for healthcare. In the States, it's a major issue for a lot of people, especially people who have chronic illnesses, because they have difficulty paying for their care. It's a cultural and political difference as well.
It could be the case that some poor people may feel that they can't afford to see doctors regularly. Is it the case?
Yes, we have a program in the States called Medicaid, which is supposed to help the poor pay for health care. But because of the way that the system is set up, it's not comprehensive care that takes care of people and make sure that their disease is managed. It tends to be more episodic, meaning when they get sick, they go get care. With the NHS, because you don't have to worry about whether you're going to be able to pay for care, your disease can be managed much more carefully. The United States spends close to 18% of its GDP on healthcare, and we have poorer outcomes. The NHS spends 9% of GDP on healthcare and has much better health outcomes. So you're getting, here in the UK, you're getting better results for less money, which I think is very intriguing. It's one of the things I wanted to learn about.
What difference has Barack Obama made to USA healthcare system?
Well, he's had a major impact. Probably the signature piece of legislation from his first term was a healthcare reform bill, which will ensure access to insurance for millions more Americans who couldn't have it before. We had roughly 15% of our population was uninsured, and the healthcare reform package that was passed in 2010 will give that population access to insurance. It won't guarantee that everyone gets health care, but it should make it easier for people to be able to pay for it. And that's certainly a step in the right direction.
Could you tell us the difference between Medicare and Medicaid?
Medicare and Medicaid are two programs in the United States to provide insurance that is paid for by the government to specific populations. The Medicare program covers the elderly. It covers people over the age of 65. It is funded by a specific tax that workers pay, and the government pays benefits on behalf of the elderly to the doctors and hospitals that treat them. The Medicaid program, on the other hand, is a federal and state partnership. The federal government and the states share the cost of that program roughly on a 50-50 basis, but it covers a number of populations. It covers the poor, poor children, patients with end-stage renal disease, the blind, chronically disabled patients, and elderly in long-term care, for instance, nursing homes. It tends to vary a bit more because we have 50 states, therefore we have 50 Medicaid programs. But one of the things that Barack Obama's health reform package has done is expand the coverage under Medicaid to apply to a broader population. So folks who can't afford private insurance in the regular market will be eligible to use Medicaid. So that's one of the ways he's going to expand healthcare coverage in the States.
What's next?
I'm not sure. Right now I'm going to enjoy my time here at Oxford. I've been really enjoying it so far and really thinking about applying for a studentship for a DPhil. But at the time, my plan is to go back to the States and take what I've learned and try to make healthcare better for Americans.
You have enjoyed Oxford life so far. I'd like to know how you relax.
That's one of the biggest challenges of being a student at Oxford. Time management skills are really important here. I like to take advantage of the student tickets to concerts at the Sheldonian. I've gone to a couple of those. I go to the Oxford Union debates and meet other students there. And that's probably it.
Yeah. So Oxford University students often talk about work hard, play hard. Do
Yes.
you like that?
I do. I think it fits. Yeah.
Okay.
We definitely work hard, so you need some time to play too.
Thank you very much for being with us, Voices from Oxford.
Thank you, Dr. Kim.